Right.
and welcome to the program. Charles Moscowitz here. Thanks for joining me, everyone. Michael D. Shaw is my guest. He's a health writer and journalist. His articles appear at various sites, including space.com. Michael, thanks for joining me today.
Hey, it's always a pleasure. You're the man.
Michael, before we get into the question of whether or not kids should go back to school in September, I
Right.
want to address this issue that is current right now. It's big news on the Drudge Report.
Sure.
And that is that there were a group of doctors apparently who gave some kind of a press event standing in front of the U.S. Supreme Court, who are immunologists who left their jobs to do this. And they made a presentation by which they said that the nation has got to start using hydroxychloroquine to save lives. And this coincides with this immunologist from Yale, Dr. Reish, who
Right.
has been saying the same thing. He was on Fox last night saying that he believes that hydroxychloroquine can save up to 100,000 people. The thing that troubles me about this is that the video of this was banned by YouTube and by
Oh, of course.
Facebook,
Of course.
and that in fact you cannot even mention the word hydroxychloroquine without running the risk of having your station taken down and being banned. So, um, it's I just am troubled by that. Do you have any information on that? I'm not here to endorse hydroxychloroquine or anything else, but I am concerned about this from a free speech standpoint.
Well, I mean, there is no free speech, you know that.
Yeah.
And the thing that's puzzling about it is I'm not sure why the internet Mandarin class decided to jump on this particular issue so much, um, because they're really behind the curve. Hydroxychloroquine has always had good results, but the pharmaceutical industry, certain aspects of it, not everybody, was not terribly pleased about the fact that a cheap drug, a generic also, could be successfully used. There's no question it has been. But what happened with this was that when Trump advocated it, of course, that had to be by definition bad. And it took on a life of its own, but there's results coming from, I just read from Turkey a couple of days ago, that they were able to use it very constructively to save people. So there's absolutely no doubt that this drug is effective, but it isn't part of the narrative. Although I think that Facebook and YouTube are going to find themselves, uh, as I said, behind the curve, because it's not, it's the wrong thing to ban at this point. But they're, once a fascist, always a fascist, and they don't change. They're hurting themselves at this point.
Now, what could possibly be the motive for trying to suppress information about hydroxychloroquine? As you mentioned, the recent study out of Turkey indicates it's being used successfully. It's been used successfully in Israel, in France, in Italy, in England, in Spain, in Taiwan. I mean, it's being used all over the world and successfully. It's not perfect, and there are probably health risks associated with it. And I just want to be on the record as saying that one should not go out and use it unless you have a prescription from a doctor and you are under doctor's supervision. I mean,
Right.
it's a serious drug, but it seems to me that the motivation can either be financial or political or maybe a combination of both. And from a financial point, you kind of implied this already, Michael, when you pointed out that big pharma is generally against the use of a cheap generic drug. The hydroxychloroquine regimen is only like $20 to get the full dose you need. And meanwhile, these other big pharma has, like remdesivir was like $5,000. It turned out to not be very successful.
Right.
There's a lot of money involved here. They don't want to have this easy and cheap approach. And then there's the political piece, which is even worse in a way. They want to continue the virus. I mean, maybe until election day. I don't know.
Yeah, the
What's the
crisis will
deal?
be over on November 3rd. But okay,
Unless Trump wins,
yeah.
in
Well,
which case it'll be over November 3rd, 2024.
okay. Well, here's what's going on. Big pharma may, in some cases, not like to promote generic drugs if there's actually a proprietary drug that is effective. But big pharma, I mean, to give them their due, was not aggressively against hydroxychloroquine. They were hoping that remdesivir would work, and it ends up that was not as successful as they would have liked. And your friend Tony Fauci, as you may know, stopped that trial because the results were not very good. And the best they could report was that instead of recovering in 15 days, the patients recovered in 11 or 12 days.
Mm-hmm.
Okay, so I think it was mostly Trump, the anti-Trump thing. You know, if Trump says the sky is blue, the media will come out against it. And
I mean, how diabolical is that? You know, anything to stop Trump, including the deaths of up to 100,000 people who might otherwise be saved by means of this generic drug. May
oh,
not, but just the fact that it would be discouraged is so, it just makes me feel sick to my stomach to think about that.
well, if you want to make an omelet, you got to break some eggs, right?
Yeah,
As
that's what it
as
comes
they
down
would
to.
say. And you know, it's so important to get rid of Trump. Although, if you ask someone to explain why, they never really can.
No, they can't really, they can't articulate it. And it's almost like they have a little computer chip embedded in the back of their heads and it stimulates, it's not rational.
No, no. So I think that's the biggest factor. Is as stupid as it may sound.
Now,
And
Michael, you did an article basically talking about bringing school kids back. California has intervened, I believe, in Orange County, saying that they cannot open the schools in September. What is going on with that? How can our young children get back to school safely and in this atmosphere?
okay, the history of that thing is that Orange County, California, uh, did a very detailed study of this issue. And in my article, I cite many of the literature references that they used. And it ends up that the science is incontrovertibly on the side of returning the kids to school. There's there's no doubt about it. There's nuance, but there's no doubt about it. And a couple of days after that report came out, uh, Governor Newsom decided that uh, I forget how many of the 58 counties, but most of the 58 counties that anybody's ever heard of who's not in California were prohibited from opening the schools. Uh, it ended up being 90% of the students. And the simple reason is that this is nothing more than a hobby horse to dictatorial power. It's as simple as that.
Mm-hmm.
They love the fact that they can be in this kind of control. But the points that are raised by Orange County are very good, starting from the fact that kids basically don't get this disease, they don't transmit it. The nuance is, because I was criticized by one of my friends who's made some fine points. One is that it may be that they tend to transmit it a little more if they're older. But by and large, kids don't get it, they don't transmit it. And you can't teach with masks. Younger kids are not going to develop the proper social interaction in that manner, walking around like a bunch of masked zombies in a classroom. And the only positive argument you can make for not opening schools is that if trying to control this disease and the spread of this disease is the absolute quintessence of existence, and there's no other factors that you want to consider, then you might have a point. Except the trouble is that obviously doesn't work. There's always going to be diseases. There's always going to be some factor, but I think at this point they've shot their wad, and I'll tell you why. Because I also refer to the Ivy League schools, which are near and dear to your heart, or at least near.
Yes.
They're not opening.
Yeah.
And they're doing everything by Zoom video, as you and I are. The
Right.
only difference is that you're not charging me $50,000 tuition to be on your show.
Right.
So my question is, at whatever time the learned figures decide that we're safe, like in Marathon Man, is it safe?
Mm-hmm.
How do you get kids back to school? How do you get people back to work? You've created a new paradigm here that you can't put that genie back in the bottle so easily.
I know, and they now that they have that kind of fiat power, they want to hold on to it, I think.
Well, that's right.
It's an power is very intoxicating for political figures, that they can decide, with a wave of a hand, whether or not where they go from point A to point B. I mean, what they do and don't do. It's incredible.
Yeah, but I mean, it's very important that those rules don't apply to them.
The concern that I think with regard to the virus, and it is a contagious disease,
Right.
with regard to schools, is that the teachers are not going to be protected, or the administrators, or the people over 30 aren't going to be protected. Do you think there's a way to mitigate that in a way that they can come back? Because apparently with younger people, it's not a big problem. And obviously, if you have a young student, who does have a physical problem, I mean, they've got immune deficiency of some sort, then yeah, you may not want to have them go.
Right.
But what about protecting, the regular folk who are running the show in the schools?
Well, this is the whole thing. There was no nuance possible. They just made this diktat. I suppose if you want to say that teachers have the option to wear protective equipment, that could be in play.
Right.
But even so, the average age of a teacher, I believe, is 41 or something like that. And those people don't tend to die from this disease. So there's, people were dying of the flu also. But if I had to do the trade-off, saying fine, teachers can wear PPE, that's great. But to keep the kids out of school is ludicrous. And by the way, what about the economic consequence of the parents that, God forbid, have to work and can't watch their, especially little kids, as they're going through this Zoom education? Who picks up the tab for that exactly? So,
it's huge impact. I mean, it's a huge social impact, obviously, economically, socially, and in every other way.
they just didn't think it through.
Yeah. Now, Michael, what do you have in terms? Do you have any information in terms of the advancement of a vaccine? I think that before last time we spoke, the president has earmarked a huge amount of money to
Right.
Merck Pharmaceutical and a bunch of other partners, and to deliver 200 million doses of vaccine for free to the American people by the end of the year. Do you know anything about that? And is that something that can be trusted?
Well, other than what you said, I don't have any specific details. I do know that the notion of creating a long-term immunity for coronaviruses is not very good. And on some of the tests, not on the vaccine, but some of the tests on people who've gotten the acute disease and have recovered, the immunity, the antibodies disappear pretty much within 2 to 3 months.
That's discouraging.
Well, okay, they say the T cells last longer. There are other types of, I guess it wouldn't classically be a vaccine, but I guess they're going to call it that, where it's not so much an immunological agent as much as some sort of, if you will, nanochemical agent that attacks the surface of the virus so it can't get in the cell. I I'm not encouraged that they're going to come up with one that actually works. In fact, Bill Gates, if you want to believe him, is now harping on the fact that you're going to have dose and dose and
Yeah.
more doses, and it's completely impractical for 325 million people. I think that it's just total overreaction. You know, my contention is if you take the 150,000 so-called deaths and you remove the misreporting of this thing, and all of the poor record keeping that happened in addition to that, I suspect that it may be less than half of that number of actual deaths from this disease. And then, by the way, if you remove what was it, 20 to 30% of the people who died were in nursing homes, and they stopped tallying that, by the way, in New York, because it was too embarrassing. This comes very close to a typical flu season. But I tell people that are worried about this that they should feel encouraged. Apparently, you can't die of anything else now. No one's dying of heart disease or cancer or any other disease, you know.
Oh,
This
great.
is the scourge of humanity. I mean, look at the overreaction. You have healthy baseball players who test positive. None of them are actually sick, but they don't report that part of it. I suspect if you did a mass program to test people, you would find a lot of people are positive and they're asymptomatic.
Mm-hmm.
So what? Okay, as I said in the last show, if I tested you for human herpes virus 6, 100% would be positive. Well, so what? What's your acute disease?
No, interesting point. Is there anything we can do to reduce the effects if we are positive for this disease? Short. I mean, because I want to keep people out of the hospital and
Oh, yeah.
out of being incubated or whatever they call it.
Well, if you're positive and have no symptoms, then I'm not sure you have to do anything.
Sure.
Because the fallacy here is that there's so many passenger viruses, so-called, going around. If I did a complete virus panel on you, you'd probably be horrified. But then you find, I don't have any symptoms. If people do have symptoms, they certainly have to take care and treat it as a respiratory type illness. If it gets bad enough, then they do have to go in the hospital. They should try to keep away from infecting others. But the problem is that there's nothing inherently wrong with infecting others either, if you consider you want to achieve herd immunity. So I ask people, well, what is it exactly? You want this to go away, but you want it to just sort of vanish. Like someone pushes a magic wand and this virus ceases to exist. That's not how these things work. There tends to be a bell-shaped curve on it. There is no such thing as a second wave, by the way. That's a complete misnomer, because that would be like saying that every time you have an annual flu, this is now the 251st wave of that flu virus coming in.
Mm-hmm.
It doesn't work that way. You can create it artificially if you want. You can say, well, the deaths dropped and then they went up a little bit on this day. But then you start seeing how these are reported, and they're not equivalently reported day after day, as that case in Florida so aptly pointed. For whatever reason, sloth or whatever happened, they stored up data for a few days, and then on a particular day, oh my gosh, there's something. No, that's just what they reported.
Now, the virus does seem to be disproportionately hitting harder in the community of color. Why is that, and what can they do to protect themselves?
Well, now you raise on a very touchy point.
Mm-hmm.
Okay, which a subset of that is a subset of the following. Why did Korea do so well? Korea is a homogeneous society. The sad fact is that communities of color generally have worse health. That's just the way it is. There's reasons for that that have to do with, in many cases, bad personal responsibility. Uh, in some cases, using ridiculous folk remedies, not listening to obvious medical advice. But if you take any disease across the board, communities of color do worse. And it's always been that way. And the sad part is that when my son was in med school, he said, this is very interesting. Why don't people focus on getting some of these communities up to speed here by focusing on differences in health by race? But you can't do that work because I guess that's racist.
Well,
But
they're talking about it now.
yeah,
And I think you raise an interesting point here, which is that it is a matter of personal health. And if you go to some of the minority neighborhoods, you get like these food deserts where you can't get fresh vegetables. All you can
right.
get is sugar laden, McDonald's, and we single them out. But the diet is unhealthy,
Well,
and
if it makes you feel better, it's not only communities of color.
no,
If you look at poor whites, you get a lot of the same thing.
right.
In fact, I had an article once that was pretty sad. It had to do with uh, getting Medicaid money out for dental treatments.
Mm-hmm.
And they encountered communities in Appalachia, to pick on them, where the amount of sugar in the diet was astronomical. And the kids' teeth were rotting out from a young age. And one of these do-gooder social worker types was very surprised to find that it was quite typical for the little kids to go to bed with a large bottle of Mountain Dew and just put all the sugar. Okay, so what happens is they trace the case of some kid who developed some infection or abscess in the mouth, and Medicaid wouldn't pay for basic dental hygiene.
Mm-hmm.
So then fast forward to now, it's a terrible infection. There's now some heart involvement with this kid.
Hmm.
So instead of paying $125 for the dental appointment, they ended up paying, I don't know, something like $78,000 for the hospital care. And the kid died anyway. So it's your tax dollars at work. Public health has not reached these people. And they don't even try very hard. If you put up a billboard in that neighborhood telling them all this good stuff to do, most of them are going to ignore it. So that's really the reasoning behind this.
But I think there are things that we can do to pressure places like Dunkin' Donuts and McDonald's to maybe put a little less sugar in the donut. Nobody would even notice. They're loading it up with sugar because sugar is addictive and because it gets people hooked on it, and then you crave more. If they could cut back, I mean, in a way, public pressure can be applied. I remember in the 70s, there was a huge public campaign to get McDonald's to stop using those styrofoam casings for their
Right,
burgers
right.
because they were not good for the environment, and they stopped using them. They just used a simple piece of wax paper. So I think that as a matter of a public effort, we could pressure them to show exactly how much sugar they're putting in the food and to reduce it without affecting their bottom line, and maybe adding a few more healthy items to the menu. And little tweaks like that can make a huge difference in
Well, I mean,
terms
they
of
put
people's
healthy
health.
items on the McDonald's menu, which don't sell. Um, people eat what they want to eat. Um,
Well, I'm just saying that they could take some of these things and tweak them a little to make them a
well,
little
perhaps.
healthier. I'm trying to think about, because if the problem in the community of color, which is a problem that can affect all of us, is that we're not healthy enough, we should talk about, if there's one lesson we could take from this, how we can manage our own health better so that we're less susceptible to these diseases, or if we get them, they're less devastating to us. I mean, you mentioned, Michael, that it's as a flu, it is primarily a respiratory problem. So people with asthma or people with, smokers, frankly,
Yeah.
or who have compromised their lungs, they ought to be more careful. So that gets to a question of how do you manage your respiratory system better?
Well, there are some people who uh, are susceptible to this, asthmatics. There are many people walking around that have various respiratory issues. There are people who have one way or another compromised immune systems, either because it's genetic or because they're on various medications. And they just have to be more careful. But I mean, they always had to be more careful. And these were the kind of people that were probably wearing masks before they were even mandated.
Right.
Um, and these people generally know who they are and can uh, accommodate to this. But by the same token, once you take care of the vulnerable, that leaves the large majority of the healthy. So this non-stratification whereby everybody is treated the same is what made this current policy so untenable. And of course, if you look at the statistics, it becomes a joke that South Dakota, I mean, South Dakota is not the same as New York, but the point is they didn't do anything and they have the lowest death rate. New York and New Jersey did everything. They have the highest death rate. And Belgium is third worldwide, believe it or not.
And they had a full shutdown.
Oh, yeah, full.
People are not cooperating with the masks. There's even in my own neighborhood here in Boston, I see people not doing it, and especially younger people. Should they be doing it, and why not?
Well, there's good literature on masks. Surgical masks are worn primarily to prevent droplets from the surgeon getting into the wound.
Yeah.
Okay. To the extent that you're talking about aerosol transmission, the mask can probably be reasonably effective. On the other hand, not too many people are wearing N95 masks, and mostly because you can't wear them all the time. People prefer breathing, and that's why a lot of them switch to the so-called non-medical type of mask. But here's the problem. If something is airborne, the mask isn't going to prevent the virus from coming in. The virus is way too small. If you can breathe through a mask, a virus can get through it. So I tell people it's better than nothing.
Mm-hmm.
Which is significant. I mean, if it's
Right.
better than nothing and everybody's doing it, then that's fine. But then how far do you want to go? All right. At my gym, when it reopened, it first reopened, just come in and everyone was doing their thing. Then a week into that, they said, well, now in the choke point areas, they wish, I mean, there's hardly anybody there, of the check-in desk, you want to put it on, entering and leaving. Then they changed it to, as you're walking between stations, wear the mask. And some people even exercise with the mask on.
Oh, you
I
can't
think it's
because
dangerous.
exercise, you need a lot of oxygen. You
Yeah.
can't. You can't restrict your breathing. You'll pass out. I pass out anyways in exercise. I mean, putting that aside, that's dangerous. You need to keep oxygen flowing to the brain
Oh yeah.
while you exercise.
Oh yeah. So it can be extreme, but there are people that are really into it. I've seen the guys go off to the shower wearing a mask, for God's sake.
Yeah.
Some of these people have these heavy duty masks. You ever seen these?
Oh yeah.
It's fashioned with
It has the whole bottom of the head is covered. It's like
yeah, it's got Velcro fasteners on the back and everything.
it's like a bandito.
Yeah, some of them are probably.
I'm sure they are. So, Michael, how long is this insanity going to go on? Do you think?
Well, November 4th.
Yes.
But no, okay. I mean, honestly, there's a couple of factors that will come into play. When enough people get sick of it and just stop complying, um, because I'm reminded of, I don't know if I ever told you this story, because people ask me this right at the beginning, when is this going to stop? And it's nothing to do with the pathogen, but when is this social aspect of it going to stop? It turns out, although you're probably too young to remember, in the early 70s, there was this so-called gas crisis, and people were lined up
Right.
in the gas stations to buy fuel.
Sure.
And then what happened? It was Governor Reagan in California, where it was at the time, decided that to ease this thing, you would have even days and odd days. And even number license plate and odd number license plate could then be in line on particular days to get gas. Of course, people with two cars, they just, did whatever car they wanted. But what happened was this was complied with for about a month or even 6 weeks. And then I'd be in line and I noticed someone with an illicit license plate was in line. And nobody cared.
Right.
Because they realized, aha, now I can do this. So there was this massive non-compliance. And here's the point of the story. There was no official decree saying it's over. It just stopped because no one was doing it anymore.
It's kind of like Calvin Coolidge's Attorney General Harry Doherty once said that the best way to get rid of a bad law is to enforce it.
Yeah.
And if they try to enforce this thing, there's gonna be a public reaction, and there will be challenges constitutionally and otherwise.
The other thing that's going to happen is that when the big travel season starts, which is not really summer in the sense that, fine, you do whatever vacation, but Thanksgiving, Christmas, and so on, where traditionally people would do this, it may not come back to 100%, but it's going to come back. And there's going to be other factors that will become suddenly more important than worrying about COVID-19.
Right.
And I think that the other thing that's going to happen in the background is the unmasking, so to speak, of people like Fauci and the others. We talked about that a little bit last time.
We did.
And now there's if you've seen, there's all kinds of articles condemning Fauci from people that didn't know about this.
Mm-hmm.
And, talking about how poor the public health response has been on this thing. And there's really seems to be less of an attack on Trump per se about this rather than the public health establishment, which is indefensible. They've done a miserable job, and people are starting to figure that out.
Well, they haven't had the nerve, even though there's a lot of hysteria and panic about increasing numbers, putting aside the fact that those increases are infinitesimal.
Right.
And there's rumblings about re-shutting down cities and re-shutting down this and that. So far, no government has had the nerve to actually go through with that. I don't think they're going to.
No.
And their last line of defense is shutting down the schools for children to return. That's going to be the Rubicon that we're going to have to cross. And I think that if and when we cross that Rubicon and our children are back in the schools and people see that it's not causing this, horror, we don't see the return of the bubonic plague, Frankenstein isn't coming out, and, Count Dracula is not flying around biting people's necks. Once we get over that, then I think it's going to be over.
That's a very good point.
That's not to say the virus itself isn't going to be over.
No.
It won't be, as you've pointed out, Michael. If you're vulnerable, stay safe. Keep there's a lot we can learn in terms of improving our health and maintaining good hygiene and all the rest. I mean, I hope we can learn lessons from it, but the emergency will be over. People will start to function again. They already are.
Yeah, well, that's it. It's more what's going to happen to people's minds rather than what's going to happen with this virus. And it'll eventually just fade away.
Yeah.
People may remember how poorly this thing was handled, and this may be a lesson for the future. But we'll have to see.
Yeah. So, Michael, let my listeners and viewers know where they can read your articles and get information about you.
Okay, most of the articles are on healthnewsdigest.com, but I also mirror all the articles on my website, gasdetection.com, which is our main business. And for people who want to go back to uh, actually the late 90s, believe it or not, we archive a whole lot of material there.
Mhm.
So it's all there. And then, and what I've been doing the last several years is there's a lot of links in all these articles, which give people access to the source material, which
Good.
I think they'll find helpful.
Yes. Very good. All right, Michael. Thank you so much for joining me. Michael Shaw. Thank you.
Thank you.
Talk to you soon.